Welcome to today's American Community Media Briefing, the second of 6 briefings in partnership with the Department of Healthcare Services to track what's happening with Medi-Cal and CalAIM. I'm Selene Osterk, ACOM Research Director and your moderator for today, and today we're focusing on a vital but often overlooked topic, underutilized Medi-Cal benefits. Even though Medi-Cal offers full coverage for routine checkups, cleanings, and eye exams, only 1 in 5 adults use their dental benefits each year. These aren't just routine services, they're essential to preventing serious health issues like tooth decay, infections, and vision loss. Left untreated, these conditions can affect a person's ability to work, care for their family, and maintain their overall health and well-being. Today, leaders from DHCS and our community partner will walk us through who qualifies for these services, commonly overlooked benefits, and how members can access care today, including multilingual support and tools like the Find a Dentist app. Now, meet our expert panel, Dr. Donnie Hsu, who's the chief of the Medi-Cal Vision Program with DHCS, Dana Durham, who's chief of the Medi-Cal Dental Program at DHCS, and Eileen Espejo, who's senior manager directing of health at Children Now. And to support all our simultaneous interpreters in Korean, Mandarin, and Spanish, we kindly ask all speakers to speak at a moderate pace, and if I'm not doing that, please let me know. We also ask reporters to enter your questions in the chat, including your name and outlet. We'll hold a longer question and answer session at the end, but speakers may also respond in the chat as we go. And now we'll begin with Dr. Donnie Hsu, chief of the Medi-Cal Vision Program. He's going to speak about vision care, an essential but underused Medi-Cal benefit. Dr. Hsu, please go ahead.
Hi, good morning. I'm Dr. Donnie Hsu. I'm the chief of Medi-Cal Vision Program. Today, we're going to really talk about the shining a light on one of the Medi-Cal most essential and often overlooked benefits, vision care. Vision services are more than just an eye exam and glasses. They are a critical part of preventive care that supports better health outcomes for individuals, families, and communities. Vision care is a gateway for a whole person health. Vision services are a vital part of Medi-Cal transformation, and here's how. Early detection and prevention can be found in a routine eye exam. For example, chronic conditions like diabetes, hypertension, and neurological disorders. Under the CalAIMs, these findings can trigger a timely referral to your primary care doctor, nutrition counseling, or enhanced care management. Preventing complications and improve the outcome in the long run. Members with complex needs, the enhanced care management provides a lead care manager who helps navigate services, vision, and to get vision care, and also make sure that they are followed up. For example, a member with diabetic retinopathy might receive coordinated support eye care, blood sugar management, and housing stability. The health equity in action, by restoring, we have restored the adult vision benefits to make sure that the access to eyeglasses and exams are available. Medi-Cal is addressing these key social drivers of health. The ability to see clearly is impactful for low-income adults, seniors, and people with disability who may otherwise go without their vision care. The integrated coordination through CalAIMs empowers Medi-Cal managed care plans to coordinate across multiple disciplines, including optometrists, primary care doctors, and behavioral health specialists, and other social services. This ensures that vision care is not isolated as part of a healthcare team. And the community support, along the lines of CalAIMs, funds non-medical services that supports health. For example, transportation, to the appointments, home modification, and other cares that part of the whole collective package. And vision care matters because I've been practicing optometry for a very long time, and I see how it can impact a person's daily life and well-being, uh, daily tasks, and for example, manage, read the medicine labels, attend other medical appointments, reading instruction, getting to and from work, and care for children or aging parents. The whole person, again, is a big component. The preventive approach is hardly CalAIM's uh, initiative, is to transform how we deliver care as a collective unit, not just, again, not just eyes, not just teeth, but as a whole person. The uh, most significant event that happened recently is the restoration of the adult eyeglasses benefits. For over a decade, adults were not able to get the eyeglasses because they were a limited service. However, we restore that along with children and youth. Uh, that way, they don't have to spend out-of-pocket money to get the eyeglasses that they need. So the adult specifically means those that are 21 and over. So I always like to say that eye care coverage nowadays is regardless of age, 0 to 108, something like that. Uh, the This really enables us to have this powerful step toward total healthcare equity, recognizing that everyone deserves the ability to see clearly and live fully. Um, Again, imagine not able to see whether far or near. I need bifocals, right? So, and once again, today's Medi-Cal benefits covers comprehensive eye exams through whether it be optometrists, most likely, or ophthalmologists to check the complete scope of that vision, your eye health. And for example, somebody who is diabetic, you need to see your doctor more often, and that is also covered. The eyeglass component, once again, whether it be driving glasses, reading glasses, or bifocals, they are also covered at no cost. And other tests, for example, would be important one will be glaucoma, for example, the eye pressure in the eye. There's often does not have symptoms. And the one of the as we get older, there are folks who have age-related macular degeneration who might need specialty lenses to help them read labels. Uh, those services are also available. And one very unique coverage that we do is artificial eyes for people who lost their eye, whether it be disease or injury. We cover that specialty service that we will fit and provide that replacement eye. Specialty lenses we also cover are, for example, somebody who are unable to wear glasses, missing an ear, for example, they can get medically necessary contact lenses. So those are pretty full coverage for people's exams and needs. And very often, a lot of people don't understand, who do I go? Do I get an eye exam at the DMV? No, you do not. You see eye doctors. The most common one will be optometrists, like myself. Ophthalmologists are physicians who specialize in more advanced diseases. And lastly, the opticians, those people who help you pick out glasses and fit you, as well as the ocularists who will measure the artificial eye and for people to function after surgery, for example. And the Medi-Cal, we partner with our own lens factory, and we produce lenses for children that are under 18 years old, have special lenses that are unbreakable. Adults who have far near needs, for example. We also provide these special lenses that are bifocals that you can see far and read at the same time. Now, common question may be, what if I lose my glasses or broken? They can't be replaced. And so no concern there. Uh, the members can access the vision services. Oftentimes, you can go directly to these eye doctors and you do not need a referral because this is considered pretty primary care. And to find a provider is, and we have doctors in all the counties. And what you do is contact the health plan that you are enrolled in. They can guide you in finding an eye doctor near you. For example, the big county like Los Angeles, they have LA Care. Uh, they would have doctors through the Vision Service Plan group. Another interesting one, new plan will be Kaiser. You have Kaiser Health Plan. You can go to the Kaiser doctors. So they are part of the total kit. And any questions, you can definitely direct them to your particular plan that you're enrolled in. You don't need to go anywhere else. But DHCS, we are available to help people. We have a website with frequently asked questions that most people can go to. And not everybody's very computer literate. You can go call the R800 number, and that's pretty easily I remember it already. It's 800 541 5555. So all those are resources available to you for questions and assistance.
Thank you so much, Dr. Shu. I wish I knew all this when I was replacing my glasses last month. We have many questions in the chat for you,
Okay.
some regarding both the dental too, so I'll kind of stream it toward the vision. But from Caesar Newcomb, has this trend of Californians missing out on free eye care been there for years now? How long has this been going on? What have been reasons for this in the past and up to now?
Okay. Um, Eye care is available through the plans and the affiliated doctors to that. Now, it is primary care. I practiced for a long time. Usually, people are what we call asymptomatic. Uh, that means they're saying fine unless they get screened by schools. They self-refer. And as of late, there are a lot of discount places that people get eye exams, whether it be Costco, Walmart, things like that. And, I think education would be very helpful to let folks know that you do not have to pay for these services that are part of your coverage. So I think education might be helpful, but it's always been uh, available all these years.
Okay. When we were talking in preparation for this briefing, I was told I was given the image of 1 million eyeglasses being distributed, which seems like such a lot. Journalists go crazy for these images, but out of 15 million Medi-Cal enrollees, I'm wondering how many you think are needed.
Yeah, definitely. Like I said, we try to all the orders that come in, we fulfill every single request. We don't deny services. So therefore, all you have to do is just ask, and you will get, eyeglasses provided for you.
Okay, that's a good message. All you have to do is ask. And Keyoung Pang asks, many older Asian adults or Asian immigrants tend to seek care only when serious vision problems arise. How can DHCS and our media help shift this mindset toward preventive care?
Yes, you're right. I did allude to the fact about glaucoma. There's asymptomatic. That means you don't feel pain, for example. Uh, Fortunately, in the state of California, we do have school screening requirements from the Department of Education. And well, DMV is kind of by default, but you're right. I think community education would be helpful.
Okay. And I'm sure Eileen Espejo can speak to that as well. And I'm wondering if there are any new trends in what you're treating for other than routine checkups. For instance, like as more of the population ages, is there more demand for glaucoma or macular degeneration care?
Yeah, well, the common one is cataracts, and that is part of aging. It's not a disease process necessarily. Uh, and cataract can impact the vision to a point where surgery is required. And people do ask me about cataract surgery; they are covered as well. So uh, you're right. I think folks, the easiest one will be as we get older, can't read up close. That's a common one. So they will very likely self-refer. So we do offer those kind of treatments. So again, we are prepared, meaning that if they need more members require bifocal, we have that available as well.
Okay. Oh, this is a good one. What are some basic questions that patients should ask their eye doctors during exam? That's from Tanay Gokale.
Okay, common questions. As a practitioner, the good one will be what concerns you as a person, right? I'm having difficulty seeing at night, or you know, uh, feel free to ask doctors what your concerns are, right? So it's our job as clinicians to target it, whether it be something that is related to other health issues or something that we can treat. So again, I recommend any question is welcomed. Uh, you know, whatever concerns you, but the doctors will, during the course of the exam, evaluate uh, the function of your eye, right? So they'll bring things up that you might not even know about. So it's a collective teamwork.
Wonderful. And Maria Oliveira asks, what is the average time it takes to receive the glasses?
Okay, yeah, I would say under 2 weeks because there's a ship. What do you call that? It's very similar to the time frame required getting from a Costco, for example.
Cool. And when you mentioned, the various places you can go to as an adult to get this care, I'm wondering about children in grade school. Like, are schools checking for the eye problems now?
The grade school kids to get the referral, and I've signed up those referrals as well because they will bring a paper. I used to practice in San Francisco, and they will bring a piece of paper from their school. This child failed, and please, you know, do the exam, and I'll sign off and validate the fact this child's been taken care of. So we do that, and like I said, we take care of uh, children often because they change your vision quite often.
Gotcha. And here's a question. Does diet or exercise affect eye health? As a kid, I was told carrots were good for vision. Maybe I knew this myself.
I'm not a nutritionist, but good nutrition is always helpful. In some development country where poor nutrition can impact, for example, night vision, uh, but less so in the States. But definitely, a good nutrition is always a positive.
Okay. And let's see. Yeah, one more. We have two related questions from Pamela Ancheng and Elena Kuznetsova, and probably others as well. But the gist is, do you expect a reduction or increase in Medi-Cal enrollment, considering that people have learned about the free eye care on the one hand and the current migration situation on the other hand?
That's a somewhat complicated question. Our job is to provide care for people enrolled in Medi-Cal. And again, that is a provider enrollment question. Uh, but my go-to answer to members is that if you are what we call the full scope or member with full benefits, you are entitled to vision benefits. No
Okay,
question,
wonderful.
no questions asked.
Yeah. So user benefits now is a good message. And she says, thank you. Well, with that, thank you, Dr. Shu. And yeah, please stay on as the questions will continue. That was a fantastic talk.
Good. Thank you.
Um, Now, please welcome Donna Durham, Chief of the Medi-Cal Dental Program, who will share what dental services are available, who qualifies, and why it's important to use a dentist regularly. Donna, please go ahead.
Thank you so much. So glad to be here. Want to excited to talk to you about dental benefits. Dental benefits are a benefit that comes with qualifying for Medi-Cal. So when you qualify for Medi-Cal, you also qualify for Medi-Cal Dental. Children under the age of 21 are guaranteed coverage, and that really syncs with federal law. And in 2018, California elected to offer dental benefits to adults. So the benefits are for everyone who is eligible for Medi-Cal right now. That includes right now undocumented individuals and those with other immigration statuses. I'll talk a little bit later about some changes that'll be upcoming to that, but just wanted to really emphasize that it is a benefit, and dental is important. Dental really is part of CalAIM. As y'all have been in these discussions, you've really learned that CalAIM is intended to treat the whole person, and that's their medical issues, mental issues, social issues, but also dental issues. CalAIM encourages providers to focus on keeping people healthy, not just treating people after problems happen. So we are really looking at preventive care more than reactive care, so that we can help people from getting to a point where they get really sick. We want to make the care consistent and accessible. And we're doing that by working to improve access and really working on quality, as well as trying to align our services with national standards or what happens with the commercial industry. So we do that as best we can. Some of the things specific to dental that are a focus in CalAIM are the preventive care, and that would include things like fluoride varnish, and that's helpful usually for kids, and also sealants, and education about oral health. We also promote dental homes, and that means going to the same dentist, being able to keep that dentist so that you don't have to find a dentist every time you have an issue, but going to someone who has been caring for you and is familiar with what's going on with your oral health. There's silver diamine fluoride, and that stops tooth decay without drilling, and that's usually pretty helpful for younger children and older adults. And then finally, Carrie's risk assessment for children 6 and under, and that tailors really based on individual risk, and it allows for more frequent preventive services. So let me tell you just the things that are covered with full scope Medi-Cal dental services. That includes checkups, cleanings and x-rays, filling, root canals and crown, gum care and deep cleaning, dentures, that includes full and partial, braces for qualifying children, emergency care for pain or infection, dentures, both full and partial for missing teeth, as well as anything that is medically necessary. So not everything is on this list, but if something is medically necessary, it is able to be a Medi-Cal benefit. There are certain instances in which people qualify for implants, but not always. I do want to talk a little bit about some changes that are coming up, and they will start on July 1st, 2026. And as I said, that's July 1st, 2026. Most members are not going to know there's a change, but there will be a change to adults who are 19 years or older, who are not pregnant and have certain immigration statuses. The immigration statuses that are impacted by this include those undocumented immigrants, individuals who have a green card for less than 5 years, people who are permanently residing under color of law, also known as PURCOL or PRUCOL, qualifying through a state expanded expansion or humanitarian program. So someone who's qualifying because they're a victim of trafficking or crime, or have another immigration status that does not qualify for full scope Medi-Cal. We're going to drop a link into the chat with a chart that shows what immigration statuses do not qualify for full scope Medi-Cal under federal rules. So after July 1st, 2026, adults, that's those who are 19 and over, who are not pregnant, and in those categories, will only qualify for emergency dental care. And emergency dental care are things like you've got an infection or you have really bad tooth pain, and then you can get those services covered. Children, that's anyone under the age of 19, and people who are pregnant will continue to receive full scope dental benefits regardless of immigration status. And that's individuals who are pregnant up to a year after giving birth. And just want to make sure that that's clear, and we'll really interested in making sure that we are able to cover everyone who needs care. So if you know someone who's undocumented or who has an immigration status that will lose their full dental benefits in July 2026, we really want you to work on having them use those benefits. There are community health workers that work specifically in dental areas, and they're available with many dentists work with them. And so do want to make sure that if you need help or someone needs help navigating, they can ask for that help. So how is Medi-Cal Dental done? Well, it's done in two ways. One is managed care, and managed care is mandatory in Sacramento County and voluntary in Los Angeles County. And then there's fee for service. And so the Smile California site is fee for service. And that's where you find the dentist, the website that says if you find a dentist. And most places in California are in fee for service. And that really means you can go to any dentist who accepts Medi-Cal without needing to join a plan. So if you're in a plan, you contact your dental managed care plan if you need help. And in fee for service, you'd use the provider search directory. And I'm going to ask someone to put that in the chat, as well as the Medi-Cal Dental Member Services Center. And as I said, there are community health workers that are available in dental, and those are trusted members of the community who help patients understand their benefits, make appointments, and overcome barriers like if you're having an issue with language or transportation. And that's really a step towards making dental care more culturally responsive. And why this is really important is because a lot of people don't know that they have dental benefits through Medi-Cal. And these services really are meant to help prevent pain and avoid costly emergencies and support overall health. Your oral health really is tied into your physical health, and it can be an indicator of when there are other physical health problems. And so we just feel like that's such an important thing to get your overall health taken care of, and really want to appreciate your key role in spreading the message that dental benefits are available. Dental really offers important benefits that help keep our families and community healthy. And sometimes people don't know they have them. So if you know someone who can use dental benefits, these services are available and they are at no cost to eligible members. So if someone goes to a Medi-Cal dentist, they do not pay. So we just ask that you talk to your family, your neighbors, your community, and let them know that dental care is part of Medi-Cal. And if you know anyone who's a dentist, we also would love for you to help them become a provider in Medi-Cal dental. And the more we get this information out, the more we can help people stay healthy. But just really appreciate the ability to talk about this.
Thank you so much. That was fantastic. And it's related to a few questions I'm getting to the effect of dental care is so universally important. Why are enrollees low for this benefit? So, like, would it be fear of going to the dentist or not knowing it's available or the shortage of dentists you mentioned?
Probably a combination of all of them. And we are working to make sure we get more dentists enrolled. That's really an important thing. When someone enrolls in Medi-Cal, they're told about dental, but it is not as prominent. So we do want to make sure that everyone knows that they have the ability to go to a dentist. And just want to make sure everyone knows that dentists are available. And just sometimes people say that they can't find a dentist. We have that find a dentist tool, but we also have started care coordination as well as community health workers. And what care coordination is if you have a really hard time finding a dentist or you have some really complex dental issues, then Smile California will help you specifically get those appointments and coordinate what is needed. So that's why we put the phone number there as well as the find a dentist, so that we can make sure that people get the help they need to navigate to dental care.
Great. And a question, and Griselda's put the phone number for that in the chat. Question above that, why are dentists more reluctant than other doctors to take Medi-Cal? If they are, that is.
Well, I'm not totally sure they're more reluctant, but sometimes you do have dentists who have had a hard time. One of the things was it was more difficult to enroll in as a provider, so we have streamlined that. We've worked really hard over the past several years to make becoming a provider in dental easier. So we work really hard to do that. And we also, some people are afraid that they'll get a lot more members. So sometimes we've worked with providers to make sure that if they don't want their name in a directory, they can be referral only. So we work really hard with providers to get them to be Medi-Cal providers.
Okay. And a related question from Araceli that concerned both services, so I'll ask it for dental. Why do you think many older adults aren't aware of dental services? And why at this age is it more important than ever to take care of our dental health? How can this lead to other conditions or worsen them?
That is an amazing question and really appreciate you asking it. I think people just aren't aware, probably because they've been in Medi-Cal before. Dental was available to adults. As I said, we've only had that since 2018. So it's really important that we continue to spread the message of dental being available. I don't know if you've ever gotten the packages from Denti-Cal, but there's so much information in there. Sometimes it's a little hard to wade through. And so just want to make sure that we continue to spread that message. As far as oral health in older adults, it really is tied to overall health. And I'll give you a little example of what that is. Sometimes if you have bleeding gums, then what happens is that your bleeding gums are sometimes an indication that you might have diabetes or be headed towards diabetes. It's not always, but it's often tied. There are other things that bad oral health will lead to having potential problems with, and that's some cardiovascular issues and other things. And we're working really hard to integrate oral health with physical health long term.
Wonderful. And a question from Tane Gokale. The perception is that dental care is often expensive, even if it is covered by insurance. How do Medi-Cal copay slash deductibles for dental care compare to other insurance providers in that regard?
I love that question, and thank you for asking it. First of all, a Medi-Cal member should never be paying for dental care. And let me state that again. A Medi-Cal member should never be paying for dental care. Why that is so important is sometimes most, even in commercial, coverage doesn't cover all of a dentist's care. Like, I don't know about you, but with me, I have to pay more when I go to a dentist, and like they won't always cover um, all of a crown or something like that. So I often have a copay with it. Well, when you're working with the dentist, they can't charge for a copay or anything. So just want to make sure that people are aware that if something is medically necessary and appropriate, then Medi-Cal will cover that. Sometimes the dentist has to ask us if it's medically appropriate and necessary. So that would mean that you have to go to the dentist twice, first to get looked at and get diagnosed, and secondly for the follow-up treatment. But you should never be paying for dental through that.
Wonderful. What a message. And one more, since everyone may not have a sense what it means that you're, bolstering these services through CalAIM. What is the difference between Medi-Cal and CalAIM, and when did the CalAIM initiative start?
I cannot give you exactly when the CalAIM initiative
Oh,
started, but it started, and it historically goes back before our first waiver that got into that, and our first waiver that authorized CalAIM as a formal program was in 2020, but there were a lot of things that led up to that. And CalAIM is really a reforming of Medi-Cal overall. And what I mean by that is before everything was a little disjointed, and we really kind of often we began working with people on reactive care. And the point of CalAIM is to see a person as a whole person. What's going on with you? How do we help you get treatment before you start showing signs? And how do we help really get you to the point that you are able to access care before you get sick? It really is a transformation of Medi-Cal overall.
wonderful. And due to time, we'll move on to the next speaker, but I really want to encourage our speakers to answer any relevant questions in the chat. I know Nancy Tran had a great one about what the effect has been for children of watching too much screens. And there was another one from Mira Kaimal. Does that mean dentures are covered by Medi-Cal? While we get through that, I will thank you so much, Dana, for the wonderful
And
answers
y'all
you.
are going to love Eileen. She is just amazing.
Yeah. Yeah, thank you. Now, please join me in welcoming Eileen Espejo, Managing Director of Health at Children Now. Eileen has been a leading voice in expanding access to medical and dental care for children across California. Through her work at Children Now, she's championed both legislative advocacy and on-the-ground initiatives, including school-based programs that bring oral and vision health services directly to students where they learn and grow. Eileen, we're very excited to hear from you. Please go ahead.
Sure. Thank you so much for having me. I really want to shout out to Department of Healthcare Services for the great partnership that we've enjoyed between Children Now and the agency to really make sure that services are reaching children in California. So I, at Children Now, lead our oral health policy and advocacy efforts, but where it makes sense and where I've actually channeled my health team colleagues, I will also speak to the vision care that Dr. Shu had covered earlier. What I want you to know about oral health, and as you've already heard from Dana, is that it really is a gateway to overall health. So when it comes to a child, if a child has untreated tooth decay, or if a child has tooth pain, that can lead to difficulties in both sleeping, it can lead to difficulties in eating, It can lead to difficulties in talking and speaking. It can lead to difficulties in concentrating, say on a school lesson, for example. Chronic absenteeism and poor oral health among children. There have been studies to show that children with oral health problems actually have lower academic performance, in part because they're having toothaches, or they have tooth infections that they're suffering from, or they're missing school because they're just not there. And who are taking the children to these appointments are parents who are then not working. So you can kind of see the cascading effects that one's oral health can have. But from the perspective of a child, it also affects their emotional health too, right? Like if you're a child and you have cavities, you might feel a little bit less shy about engaging with your peers, or you might, one, be in pain, but you also might just not feel like you're going to be social. You might feel like you can't smile. You might feel that if your teeth are have cavities, that it's not like a safe space.
We're
So,
asking you to slow down just a bit for our
oh,
interpreter.
I'm so sorry.
No worries, I do the same thing.
I'm very excited about this
I know.
topic. So there are a number of areas of a child's life that are impacted if they have poor oral health. And that is why, if you can we'll take several messages from today, but one message is really across the board that prevention is key. We don't want to see kids in pain. I did see something in the chat about, even children as young as 1 year of age or 3 years of age are showing up with cavities, and that is heartbreaking. In these cases, we really encourage parents and caregivers to bring their child not just for regular dental checkups, but also for regular just child visits. Dana had spoken about medical dental integration, and we know that a new parent, is more likely to bring their child to a pediatrician more often than to, say, a dental provider, which makes sense. So we at Children Now work really diligently to improve medical dental integration, to really figure out how can we educate primary care providers to be that trusted source of information, and to be that messenger to parents to say, hey, do you have a regular source of dental care? Do you have a dental home? If not, here are some resources. We think that's really important, because perhaps a parent is going to trust that message coming from their medical provider. Not to say that dentists don't play a role, that hygienists don't play a role, they absolutely do, but just trying to reinforce the messages that parents and caregivers can act upon. I was saying earlier about how school performance and oral health is tied together, and how there's chronic absenteeism. We've seen research where oral health problems are one of the main reasons why children are missing school. It also means that schools are getting less funding when children aren't in their seats. So again, you can see these cascading effects that just oral health has on a child's social health, their mental health, their physical health, and all of that. So I also want to make sure that you all are aware that children, no matter their immigration status, are covered in Medi-Cal. So all the Medi-Cal changes that Dana had referred to earlier does not impact children under the age of 19 who are enrolled in Medi-Cal. So it's really key to make sure that our children, all of whom are income eligible for Medi-Cal, are getting access to all the services they're entitled to through Medi-Cal, which includes dental and vision. The tie I want to make to vision specifically is that, similarly to oral health, if a child doesn't have great vision, then they're also going to be suffering from possible either social isolation or academic performance, certainly if they're not able to see clearly. So it's really important that problems do not go undiagnosed and untreated. And again, prevention is key. Uh, the other thing I want to point out, and I'm happy to share these in the chat later, but there are a number of resources available for parents. There's a new parents kit that First Five California puts out. It's in multiple languages. This is something that can be shared far and wide, so that they understand the importance of cleaning their child's teeth, especially for newborns. Newborns, even though their teeth may not have emerged, still really important to even just wipe down the gums after breastfeeding or after bottle feeding. So some parents may not know that, but it helps set the foundation for healthier teeth to come in when you have clean gums. Another good resource that I've seen is called Brush Book Bed, also available in multiple languages. So Brush Book Bed is a practice that a lot of local health departments through their local oral health programs are trying to promote to all families and communities, where the parent, caregiver, and their child are bonding through going through a toothbrush routine and then reading a book together and getting that child ready for bed. You'll notice that I didn't mention anything about a bottle for younger children. That is because there are some practices which don't help promote oral health so much. And one of them is putting a child to bed with a bottle that actually, depending, of course, what's in the bottle, which is usually formula or breast milk, that does promote tooth decay if you're not wiping down that gum right away. It's not a best practice, but trust me, as a parent of older children, but it was much easier to be able to put my child to bed that way. But we needed to use a pacifier instead of a bottle. So there are several resources out there for parents and caregivers. But if anything, I just want people to understand that prevention really is key. We don't want to wait to see a child in pain from something that's preventable. I'll stop there, Selene, and sorry again for speaking too fast at the beginning.
To be the opposite of sorry, that was fantastic and a great final message. And I'm wondering if you've seen a regional difference in life-worsening challenges that children face, like absenteeism, for instance, whether it's worse in rural areas in California where access to dental checkups may be harder, or whether it's more
Sure.
financial.
That's a great question. Children Now does work with the State Office of Oral Health that's situated in the California Department of Public Health agency, and I'm happy to also follow up with resources here. But according to their last SMILE survey that was conducted, I want to say it was in 2020, but I know it's being updated. But according to the last SMILE survey of third graders, there were regional disparities in terms of untreated tooth decay, primarily in the San Joaquin Valley and the northern region of the state. Some of that might track with providers, but certainly there might be other factors going on as well. And I'm really happy to share more information about the local oral health programs that are available in all 61 local health jurisdictions, because they will also have some really great information that they can share in terms of what they're seeing and how they're trying to connect children to care.
Please do. Yeah, we have some reporters asking you and DHCS staff to share any numbers that can illustrate the underutilization. So have you seen or do you expect like an increase or a reduction in engagement from children, especially with the changes in Medi-Cal and the increased need for help?
So we're hoping not, but we know that any changes to a system as wide as Medi-Cal, there's probably going to be some confusion. So really appreciate Dana again stating clearly like what's going to happen and what's not going to happen to certain populations. I think for us, we realize that children may be living in mixed status families, for example, and still want to emphasize that your child is covered in Medi-Cal no matter what. So it's really key to still bring children to their care. But we're hoping that that's not going to deter, that the changes aren't going to deter folks from at least bringing in their kids if they even might be affected themselves. But we haven't, like I said, we haven't seen anything borne out just yet. But I think that's why it's so important to get ahead of this, like through forums like these.
Wonderful. And related, more direct than mine, question from Nancy Tran. Basically, will cuts under this administration affect services on your end?
Not on Children Now's end. We're not going to, well, knock on wood. I don't think we have,
Yeah.
I have not heard anything about being our particular organization being affected. I think for us, we're really invested in making sure that local entities, state entities, that everybody's connected and we're all sharing the same message. So that we won't be affected by the funding.
Very
stuff.
good news. Hope it continues. A question from, oh, I guess this is more related. A question from Henrietta Burrows. How is Children Now funded?
Yeah, we're primarily funded through philanthropic organizations and foundations and individual donors. We're a 501c3.
Cool. And from Sandra Martinez, many people, especially kids, are afraid to go to the doctor or dentist. What message can we share? Or I'd ask, what message have you shared that works best to encourage them to seek care?
Yeah, that's a great question. In our experience and what I've heard is that we've found that if parents are going to the dentist, then that's a great way to kind of normalize, or just talking about it, or as you're brushing your teeth with your child, like saying like, oh, this is what someone at a dental office is going to do, or making the analogy between, how we saw your pediatrician, we're also going to go to a special doctor who specializes in your teeth. And trying to just have those normal conversations. I've also seen and actually done myself, like the knee to knee. They're called knee to knee exams, where like you're holding your baby or your toddler like in your lap as the dental provider or the hygienist is doing the actual procedures. And so that's been really helpful, I think, to kind of normalize and make it less scary.
Wonderful. And from Ling Huang, are there special dental care resources or mobile clinics available for residents who have trouble accessing a dentist? So have you been able to use mobile clinics, or is like school to school based outreach?
I have never used a mobile dental clinic before, but as Dana is putting in the chat right now, there are services available through Smile California has made partnerships with dental vans to reach hard to reach areas. So, and there could be requests that are made, for example. And then I would also leverage like school-based services as well. So where your child might go to school, it could include, and Head Starts especially too. Head Starts are a great source of where there are actual active toothbrushing programs happening, but there are probably school-based programs in the counties where your readers and consumers are that could also check with their schools to see if there are services available there.
Okay, wonderful. And have you seen any new trends in what dental or vision challenges that children come to you for? Or is it, more of small, same as ever challenges, or none at all?
Kind of say, so I work primarily with like a lot of counties that are trying to increase access to care. So what I'm seeing is that just more while there are a lot of kids that are showing up with cavities, the local health departments just need help like getting all these kids to care, especially those who identify with high needs. And then, as Dan has pointed out, Smile California is really a great resource for these local oral health programs to use to find dental homes for kids.
Cool. And a question from Veronica Wood that our DHCS partners can also answer in the chat if easier. A recent report found that use of Medi-Cal dental benefits is especially low among American Indian, Alaska Native beneficiaries. How can they coordinate better outreach with the tribal health programs? Or I would ask you, have you worked in areas with high American Indian or Alaska Native populations?
I am aware of some in the northern part of the state. Like there are those Indian health clinics, and one is coming to mind, the Northern Valley Indian Health Clinic. That is kind of the source of care for but to the reporter's point, like there may not be enough, or like the access might be low. I think this also speaks to Dana when she was talking about community health workers and trying to figure out, is the reason why a parent isn't bringing their child in because they haven't found a provider that speaks their language, or that maybe even offers services during the times when the parent is available. So I think leveraging the community health worker benefit specifically for dental services is really key.
Awesome. And yeah, feel free to answer the questions in the chat, though we're coming up on the end. So with that, I'd now like to ask for a quick 30-second or so soundbite for our media from each of our speakers. When it comes to Medi-Cal, dental, and vision, what should reporters focus on? And I'll ask Dr. Shu to start.
Okay. Yeah, the vision benefit is part of the package of services for members. So contact your plan where they have the list of eye doctors in your area.
Wonderful. And being asked if you could answer Nancy Tran's question in the chat on the effect of screen time on kids. It's very, very pertinent. And Dana, I'd like to ask you to go next.
Sure. Would like to remind people that dental is a benefit. If you have Medi-Cal, you should not be paying for benefits. So there should be no cost to your dental services. So make sure you don't sign anything saying that you'll pay extra. And the Smile California website is a great resource and a place people can find dentists, as well as help finding a dentist if they need it. Oral health is tied to overall health, and we just really feel like that's important.
Awesome, thank you. And Eileen.
I would say across vision and dental, prevention is key. Children remain eligible and covered in Medi-Cal. Please make sure that you're taking your child for regular dental and medical checkups. And there are a lot of resources out there for parents and others. So please don't be afraid to reach out for help.
Very strong 2 takeaways from everybody here. I'd say if you're entitled to benefits, use them now when help is available. And when you're setting good habits early on, adults set the model. Thank you so much to all our speakers. I want to give special thanks again to our partners, DHCS and Eileen with Children Now. I certainly learned a lot about Medi-Cal benefits on the vision and dental side. And thank you to all our reporters for joining. We'll see you next